Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Candida vaginitis is a very common infection. It affects the vagina. This condition is caused by an overgrowth of yeast, specifically Candida, which is a type of fungus. Normally, Candida lives in small amounts in the vagina, but when the balance of bacteria and yeast is disrupted, it can multiply and cause symptoms. It can cause itching, discomfort, and discharge. These symptoms can be quite bothersome and may interfere with daily activities. The itching is often intense and can lead to irritation and redness of the vaginal area. The discharge is usually thick, white, and resembles cottage cheese. Many women experience this at some point in their lives. In fact, it's estimated that about 75% of women will have at least one episode of Candida vaginitis during their lifetime. It's important to know that this condition is not considered a sexually transmitted infection. Although it can sometimes be triggered by sexual activity, don't worry, it is treatable. There are several effective treatments available, including antifungal medications that can be taken orally or applied directly to the affected area. It's also helpful to maintain good vaginal hygiene and avoid irritants such as scented soaps and douches. This type of vaginitis happens when there's an imbalance in the vagina. Factors that can contribute to this imbalance include antibiotics, hormonal changes, and a weakened immune system. Wearing tight or non-breathable clothing can also create a warm, moist environment that encourages yeast growth. Our bodies naturally have a balance of bacteria and yeast. This balance is crucial for maintaining vaginal health. The good bacteria, primarily lactobacilli, help keep the growth of Candida in check by producing substances that create an acidic environment, which is unfavorable for yeast. Sometimes, this balance is disrupted. When this happens, Candida can grow out of control, leading to the symptoms of vaginitis. It's important to seek medical advice if you experience these symptoms, as proper diagnosis and treatment can help restore the natural balance and alleviate discomfort. Candida is a type of yeast. It's naturally present in the vagina in small amounts. Problems arise when it grows too much. This overgrowth disrupts the natural vaginal environment. Several factors can trigger this overgrowth, taking antibiotics, hormonal changes, and certain health conditions. Antibiotics can kill off good bacteria that usually keep yeast in check. Candida vaginitis has some telltale signs. You might experience itching and burning around the vagina. Abnormal discharge is also common. It can be thick, white, and clumpy. Some women also experience pain during sex or urination. If you have any of these symptoms, it's essential to see a doctor to get a proper diagnosis. Section 4. Diagnosis and treatment. Seeking help and finding relief. Your doctor will examine you and ask about your symptoms. They will take a detailed medical history to understand your condition better. This includes asking about any previous infections, your sexual activity, and any other health issues you might have. They might take a sample of vaginal discharge. This is a simple and quick procedure where the doctor uses a swab to collect a sample from the vaginal area. This sample will be sent to a lab to confirm the presence of Candida. The lab technicians will examine the sample under a microscope to identify the yeast cells. This helps in confirming the diagnosis and ruling out other possible infections. Treatment usually involves antifungal medications. These medications are specifically designed to target and eliminate the Candida yeast cells. These come in creams, ointments, or pills. The choice of treatment depends on the severity of the infection and your personal preference. It's crucial to complete the full course of medication, even if your symptoms improve. Stopping the medication early can lead to a recurrence of the infection. Always follow your doctor's instructions and take the medication as prescribed to ensure complete recovery. Section 5. Preventing future infections. Simple steps for vaginal health. There are several proactive steps you can take to prevent Candida vaginitis, a common yeast infection. Educating yourself about vaginal health is the first step. One of the simplest yet most effective measures is to wear breathable cotton underwear. Cotton allows for better air circulation, reducing moisture buildup that can lead to infections. It's also crucial to avoid douching. Douching can disrupt the natural balance of bacteria and yeast in the vagina, making it more susceptible to infections. Maintaining good hygiene is essential. This includes washing the genital area with mild soap and water, and ensuring that you keep the area dry and clean. Eating a balanced diet rich in vegetables, grains, and lean proteins can support your overall health and help prevent yeast overgrowth. Additionally, managing your blood sugar levels is important, especially for those with diabetes, as high blood sugar can promote yeast growth. Lastly, if you experience recurring infections, it's important to consult your doctor. They can provide personalized advice and treatment options to help you maintain optimal vaginal health. Remember, taking these simple steps can make a significant difference in preventing future infections.